Let's study something until you become a neonatologist. So you have a 27-weeker who is 800 grams at birth. He is day of life 5, and all of a sudden the nurse calls you to the bedside because his belly is distended and he is up on his oxygen and he looks uncomfortable. You very astutely order an x-ray to evaluate. So you get an x-ray and this is what you see. And this is called the football sign because this is the falciform ligament right here. And I guess that's considered the laces of the football. I didn't name it. This is just what it's called. And then you can see that there is free air underneath the diaphragm. So there's air around the top of the liver. So this is a spontaneous intestinal perforation. The exact etiology is not agreed upon, but obviously prematurity plays a role in it. In general, we just think it has to do with the perfusion to the gut. There are things that can put moms or babies at higher risk for decreased perfusion, but one of the big things that you definitely want to consider is the use of steroids and an NSAID concomitantly. So we typically look at Indocin and hydrocortisone. There are newer studies looking at ibuprofen and steroid use together, which can increase the risk of spontaneous intestinal perforation. Management is a bedside drain to make sure the air is leaving the belly. Recent studies are showing that the peritoneal drain itself is adequate treatment instead of progressing on to a laparotomy, which is the standard treatment. And the baby will be TPN dependent while the drain is in and making sure the bowel is okay. And again, waiting for the bowel to be healthy enough to restart feeds. And the biggest thing on your differential will be neck or necrotizing enterocolitis, which presents a little bit later in the course. So spontaneous intestinal perf you'll see in the first 2 weeks of life, whereas neck you may see later. And there are other things, other signs of feeding intolerance that you'll see with neck, and there are some different findings on abdominal x-ray that you will see with necrotizing enterocolitis.